On January the 9th, 1940, Padre Pio announced his plans to develop a healthcare project named Home for the Relief of Suffering. This project was fully realized, opening in 1956. And from that time onwards, it has continued to provide medical and spiritual care for thousands of patients. The Home for the Relief of Suffering is not only a modern-day hospital and medical research center, but also a new healthcare conception where evangelical values are implemented on a daily basis. This big campus constitutes part of that shrine of Padre Pio and is situated in San Giovanni Rotondo, Italy, 4 hours southeast of Rome. Jair Palazzolo's dream is to enrich the worldwide Catholic healthcare system with the vision of Padre Pio. To do so, Jair founded a non-profit apostolate called Catholic Healthcare International in 2004.
We plan on developing a campus called the Casa USA campus in the United States in the charism of Padre Pio as he developed his Casa Sieva della Sofferenza in San Giovanni Rotondo, Italy. On our campus will include a replica of a hospital built in that charism, the same values, the same spirit. We'll also develop a pilgrim shrine because there are thousands of Padre Pio prayer groups around the world that will come and pray with us and support what it is that we're doing. We'll develop a fully faithful Catholic medical school called the School for the Relief of Suffering, again, forming Catholic physicians to practice in the charism for the relief of suffering in a very secular world, and then a network of physician practices fully faithful, fully Catholic in their delivery of health care.
Catholic Healthcare International signed a formal collaboration agreement with the Home for the Relief of Suffering on October the 1st, 2009, gaining permission to duplicate their model around the world.
Cardinal Burke has been our friend, our Episcopal advisor through the whole thing from the very beginning.
Of course, I immediately understood his vision because I had been a diocesan bishop for some 14 years. And I knew what had happened to Catholic healthcare and how desperately it needed to be restored to its origins as truly Christ-like care of the sick from the moment of conception to the moment of natural death.
The first facility that will go up on the campus will be the Pilgrim Shrine, because Padre Pio said the success of the Casa when he built it, as we are following the same way, has to be built upon the foundation of prayer from people around the world. And we've already got those people praying for us, but we want to have them come with us. And it's prayer, and in our case, Eucharistic adoration, because it's been my experience, it's been Cardinal Burke's experience, and I think every faithful Catholic has seen the fundamental impact that Eucharistic adoration has on the way, on people's faith and the way Catholicism is practiced, and the delivery of Catholic healthcare. We can't go wrong if we're built upon Eucharistic adoration.
The Church has this great gift to offer, a gift that Christ first gave in his care for the sick, but which has continued on through the history of the Church in Catholic hospitals, with these wonderful congregations of religious women and men who devoted themselves to the care of the sick. And now we need to reappropriate that, to reinsert ourselves in the living tradition of Catholic health care. And I really believe it will happen. It's a tremendous work. It involves tremendous sacrifices, but it's absolutely needed. We can't do otherwise.
A part of the concrete healthcare project in the state of Michigan and an educational program, Healthcare International has engaged in a campaign to establish formal Eucharistic adoration programs in the chapels of Catholic hospitals around the world. Jair says that in order to provide healthcare, it's important to see the suffering of Jesus in every patient. Maybe the mystery of suffering will never be understood, but we need to realize that suffering does have great value. This is why it's important for Catholic hospitals to place Jesus at the center of their healthcare activities.